Circle at Seattle's Greenwood Senior Center is a chance for older neighbors to come together and belt out a few tunes. Neighbors like Maxine Bailey.
But she still loves it, and when they get in a group like this, she just kind of lights up.
But Maxine and these other singing seniors may not remember much about this experience or any other part of their day. That's because they live with dementia.
The dementia is getting a lot worse. She's going downhill. So she doesn't know anybody's name.
For Maxine, the results of a large UW group health study involving certain medications and increased risk for dementia don't mean much. But for older Americans who have not developed dementia, they could be life-changing.
The best way to study aging in the brain would be to start when people are normal and then follow them forward.
Dr. Eric Larson is the principal investigator on the Adult Changes and Thought Study. That study, which involved some 3,500 seniors without dementia, tracked the medications they took for a period of years. About 20% of participants reported taking some kind of medication with anticholinergic effects that block a transmitter in the brain and body.
Many different drugs have anticholinergic effects, and they range from some of the older antidepressants, medications used for allergies and hay fever, medications and over-the-counter sleep aids, and medications used to treat urinary incontinence.
Those pink pills that relieve your sneezing and itchy, watery eyes, yep, those fall into this category, as do a lot of other common over-the-counter allergy medications. Dr. Shelly Gray says the study shows that these kinds of meds can put a senior at risk for dementia.
We found that the people that were the heaviest users were more likely to develop dementia over the follow-up time. People who were using these various medications at kind of average doses, if they were to use a medication for 3 years or longer, that would put them in the heaviest use group.
While the results may be cause for concern, the good news is that there are alternative medications available for allergies and depression that don't have anticholinergic effects. So seniors, check with your doctor.
You have to weigh, how much benefit are you getting from the possibility that you're giving yourself more risk, or more importantly, is there something else that would work just as well that's safer? And usually there is.
I think many people think that if a medication is available over the counter, it's safe. And so we just want people to be aware.
Back at the Greenwood Senior Center, Maxine takes in the singing and spirited atmosphere. Larry says some days are better than others.
Bunch of little steps going down, and some days there's bigger steps, but they all go down. And there's gonna be a day she doesn't recognize me.
But until then, he's content to provide her with experiences that put a smile on her face. For UW 360, I'm Sabrina Register.